The brain stops communicating with the muscles. And what this means is somebody loses their ability to use their hands, for instance, or their feet, and then other functions as it progresses.
As that happens, many people living with ALS will also lose their ability to walk, speak, swallow, or breathe on their own.
It's different in every case. And so, what happens to one person may happen differently to another.
Actor Eric Dane was 53 years old and revealed his diagnosis less than a year ago. The ALS Association says around 30,000 people in the United States are living with ALS, and most who develop it are between the ages of 40 and 70.
The challenge with ALS is there's not a biomarker, which means something that tells people that you definitely have ALS or not. What happens usually is doctors rule out everything else. And it's sort of one of the big problems is that people aren't diagnosed until very late because they've gone through a number of tests to try and rule out other things.
It is a very rare disease. As far as the research that's happening, there are signs of hope.
We just had a genetic treatment in the last couple of years come online that affects about 2% of people living with ALS. But what it does is it actually slows the progression of ALS and even restores function for some people, which is something we never thought possible. And so that was something the ALS Association invested in about 20 years ago and finally made it up this way. So we're hoping to take that technology called antisense technology and use that towards potential treatments for other genetic forms.